What can I do about my jowls?
The term jowls tends to be a general term to describe the appearance of a jawline which is not well defined. Although jowls is commonly associated with facial aging characterized by sagging skin, many younger people come into our office complaining of having jowls. There is considerable confusion about how to improve the jawline since the marketplace is saturated with miracle solutions. I'll discuss how I help my patients improve the appearance of their jawlines every day in my practice. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. My approach to jowls was first established through performing surgical procedures such as liposuction for better jawline definition and the full range of face and neck lift surgeries. In addition, I routinely placed chin and pre-jowl implants for this purpose. This knowledge of deeper facial anatomy has been the basis for the evolution of my approach using non-surgical solutions for treating jowls, which I will describe in detail. In my daily practice, patients come asking for procedures which they learned about online and from their friends who may or may not have had the procedure they're interested in. I explain to them how it's first necessary to understand the anatomical basis for their appearance before discussing treatment options. Large cap companies with big marketing budgets very effectively influence the consumer into believing that their product is new and, of course, better than everything else. Rarely is this actually true, scientifically speaking. So let's start with understanding the anatomy of jowls. As I mentioned earlier, the term jowls is often applied to the lack of a clear and well-defined jawline. This can be attributed commonly to a relative bone deficiency, excess fat below the jawline, and loose sagging skin. There are situations where one or combinations of these anatomical issues are present at the same time. When it comes to a situation of relative bone deficiency, there are several aspects of the bone called the mandible where this deficiency can be present. These include the chin or mentum, the jaw angle, and the area of indentation called the mandibular notch. The cause of this deficiency can be familial, essentially characteristics which are inherited, as well as from aging. Contrary to common perception, which focuses on the skin changes related to aging, diminishing bone volume has a more significant impact on your appearance. Typically, in your 40s to 60s, depending on your genetics, bone volume loss has more effect on the jawline than skin sagging. I approach this issue by applying the surgical principle used for the placement of facial implants to the non-surgical placement of long-lasting hyaluronic acid fillers, such as Juvederm Ultra Plus and Juvederm Voluma. This is called structural volumizing. This means that I'm precisely placing hyaluronic acid filler at the bone level to restore and enhance the contour where the deficiencies are present. I routinely perform this procedure in my exam room with minimal discomfort, minimal risk of bruising, and in minimal time. Bone volume loss also affects the cheekbones, which also support the skin that drapes along the jawline. With this concept in mind, I routinely enhance the cheekbones at the same time. I would also add that the balance of the cheekbone projection with the jawline is important in how the jawline is perceived. By applying the golden ratio or the proportion of 1.6 to 1, the face looks more balanced and the jawline appears more youthful. If the anatomic basis for the jowls is fat under the skin and the skin tone is good, then my approach is to perform suction-assisted lipectomy or liposuction. This procedure takes very little time and is performed with local anesthesia and sedation. I often find that fat below the jawline is often accompanied by fat under the chin, so I'll routinely treat this area as well. This approach is safe and efficient. Ironically, a product made of a bile acid called deoxycholic acid has been aggressively marketed as a non-surgical option for fat reduction under the chin. My concern is that the procedure requires multiple sessions over several months with significant swelling and inflammation after every session. In my opinion, this describes a product which is new, although deoxycholic acid itself is not new and it's been around for years and is in no way better than what I do with a cannula and a syringe in just a few minutes of time. The idea that the injection is a non-surgical option misses the fact that the injections into the skin and creating inflammation is more invasive and requires much more recovery than my approach of suction-assisted lipectomy. Another issue related to fat that can also contribute to the appearance of jowls is the buccal fat. Buccal fat is a specific structure composed of fat that is located in the cheeks. In some people, as they get older, some part of this fat decreases in volume and the supporting structures get loose, resulting in the fat creating a bulge adjacent to the jaw, resulting in a jowl appearance. This is not fat that can be reduced with liposuction, nor would I use deoxycholic acid. For this prolapsed buccal fat, I work from the inside of the mouth and access the buccal fat through a small opening inside the cheek. I routinely perform this procedure with local anesthesia with minimal sedation. The benefits of buccal fat reduction can be quite impressive. If there is a jowl with skin laxity, I assess the degree of skin laxity to determine if you're a candidate for a procedure called a jowl lift. This is where I use a long pulse 1064 YAG laser, or I make the decision whether to perform a surgical facelift. The jowl lift procedure involves the use of a 1064 YAG laser to heat the skin and the fat from the outside to a target temperature, which induces both fat destruction and skin retraction. This procedure is performed in an exam room and it takes about 15 minutes per session for about 3 to 4 sessions spaced about 1 month apart. This procedure is best suited for people who have good skin tone or the skin is not very loose. When the skin is loose and the jawline is not well defined, a facelift or face and neck lift procedure is generally the appropriate option. This procedure is not just lifting sagging skin, but it's also addressing the underlying tissue connected to the facial muscles called the SMAS, or superficial musculoaponeurotic system. This deep tissue is the foundational support of the skin and is often referred to when a patient asks about tightening the muscle during a facelift. I perform face and neck lifting procedures using local anesthesia with light IV sedation. In addition to avoiding general anesthesia, I use advanced wound healing technology such as acellular matrix for better healing of the incisions. My patients are comfortable during and after surgery and are able to go home with a minimal facial dressing. My patients go back to work in 1 to 2 weeks with better looking jawlines. I do emphasize to my facelift patients that your appearance after facelift surgery is also affected by the underlying bone structure and your skin elasticity. You can think of facelift surgery as a way to restore the anatomy of sagging tissue. Your appearance can be further enhanced by addressing the age-related bone volume loss with structural volumizing. Not having a well-defined jawline due to the appearance of having jowls can be very distressing. It's generally appreciated that people who are considered attractive regardless of age tend to have nice facial definition and harmony characterized by well-defined jawlines. In this current environment, there are all kinds of skin-level devices and dissolvable threads creating a lot of buzz through aggressive marketing and absolutely absurd claims. It's important to understand the anatomical principles for your situation so you can avoid being misled by flashy marketing. I always tell my patients that you define the problem before you work on a solution. For example, if the appearance of jowls is due to a relative bone deficiency, even a subtle improvement of the jawline through structural volumizing can make a significant impact on how you feel about your appearance, and the results are appreciated immediately. In conclusion, your facial bone structure, the presence of fat under your skin or in the buccal space, and your skin tone can all be addressed safely and effectively to help you keep your jawline looking its best at any age. I hope you found this information helpful. Thank you for your question.